Hey, everybody. So glad that you're able to join us today. Pastor David here, and I wanted to sit down with some people in our community who really actually know a lot more than I do about what's going on, and really just ask some questions that I'm sure are on everybody's mind right now. So I have with me today Ginny Bowman, who is a member of our Pearland campus, and I'm going to let her introduce herself to y'all. Ginny, if you could just kind of let everybody know what your role is and who you are, that'd be great.
Hi guys, I'm glad to be here with you today. I have been a registered nurse for 35 years. As hard as that is to say, it's true. It's been a long time now. Most of my career I have spent taking care of oncology patients, and I've worked at MD Anderson for the last 30 years. In that role, I now have an executive leadership position and work in ambulatory administration. So as David said, have a little bit of knowledge about this because we've been dealing with this on the front line every day. So I'm happy to be here.
Yeah, thank you, Ginny. Well, let me just get right into it. I'm gonna maybe start with this question, as I'm not sure that I totally know the answer to it. I know there's a difference between the flu and COVID-19, but I'm not sure that I know exactly what those differences are and what makes this so much more serious.
Well, I think the first thing is that this coronavirus, the one we're calling COVID-19, is different. This is the first time it's been documented to be transmitted in humans. So it's been documented in the past in animals, but never in humans. It's highly contagious. I think that's the biggest difference from influenza. However, let's remember we have a vaccine for influenza. And even if the vaccine we have this year, let's say for 1920 flu season, isn't the exact strain of flu that we actually see in the population, it still provides some immunity. So someone who's been vaccinated might still get the flu, but they're going to recover more quickly and in most cases not have such a serious response. We don't have a vaccine yet for COVID-19. So that's one of the reasons it's so much more serious. And it's a lower respiratory illness. And for whatever reason, it gets down deeper into people's lungs,
Okay.
which makes people more ill.
Okay. So that is something that I've wondered. It does seem like it is a little bit more dangerous than the flu especially for some people. Is that correct?
That is correct, though we need to remember that the flu is also very dangerous for our elderly population, but this does seem to be a little less dangerous for children, and flu can be very dangerous for young children because they're both respiratory. And the big thing is that any respiratory virus will greatly affect people who have any kind of respiratory complication that underlies their general health.
So that's helpful. And we've been hearing about this and kind of have this sense that it is new and that it is going through the population very quickly because of how contagious it is. And a lot of us have heard about, flattening this curve.
Mm-hmm.
Is it one of these things where I'm trying to understand that, like, it's here to stay and it's going to be part of our lives, kind of like the flu is? Is that correct?
I do believe that's correct, David. I think we all believe, I think the scientists believe that this strain of coronavirus is not going away. There's there's several strains of coronavirus. One of them causes what we call the common cold. And but that's a different coronavirus. This one, so it'll probably be around. I don't expect it to completely go away. The goal is that we'll have some sort of vaccine available in the next year or so. And the people who are recovering hopefully now carry antibodies to make them immune to it. So I heard a report this morning that they're looking at blood tests to test for coronavirus, this
Mm,
particular one. Then they would be able to test to see if you have antibodies.
mm.
So those of us who've been vaccinated, say, or had the chickenpox, they can draw blood on me and they'll see that I have a positive antibody to chickenpox because I had chickenpox as a child.
Okay.
So I shouldn't be able to get it again. Hopefully, we'll be able to test for this. And even if people don't realize they had it, they might be immune to it. They might have antibodies because they had it and didn't even realize it. Those
Okay.
people then should be more safe to get out and about because they're not at risk and they're not putting others at risk.
And they wouldn't be a carrier either then
No,
okay.
no, you're only a carrier per se if you have an active infection. Maybe you don't realize it, but you're actively, what happens with virus is the term is that you're shedding the virus. So you
Okay.
have to have a high enough level in your body that when you cough, those droplets from your cough are have virus in them. So it's called shedding the virus, and that's how you spread it.
Okay.
Having antibodies to it, you don't shed the virus anymore.
Okay. So it fights that process. So do we all eventually have to get COVID-19 unless at some point we're vaccinated?
Hopefully not. Some people probably have some natural immunity to it. But we might all at some point, yes, have to get it to develop those antibodies or get the vaccine. And I believe very much that we will have a vaccine.
And so really, as I understand it, what's happening now is we are just trying to prevent a scenario where we overwhelm our healthcare system and are unable to treat people who are sick. That's correct?
That is correct. That's the whole point of flattening the curve or slowing the spread, whichever phrase you want to use, is that we let it, it's going to move through our communities and through our populations. But if we can slow that down enough, then we're not looking for ventilators because the ICU is overwhelmed and too full.
Yeah, okay. Okay. And just kind of, I know everybody's wondering on so many levels, how long this is going to last. And I know you can't answer that question, Jen, but like basically from a conceptual level, it's going to last once we get past this kind of point at which we're fearing that we're going to overwhelm the system, when we sense we're going to be able to handle whatever happens. Is that right?
That's true. Yes, we just want to be able to slow it down enough that people continue to get it, but we're not multiplying the numbers of positive cases on a daily basis by some ridiculous exponential, factor.
Right.
Now, right now, it's doubling and tripling daily because we're doing many more tests,
Right.
not because that many more people are necessarily becoming infected that quickly.
Yeah, it seems like data is really hard to read at this point, and there's a lot of variables that are not being accounted for, and that's what you're saying.
Yes.
Yeah.
So the testing is really just now becoming widely available in the state of Texas. So, and New York's had many tests for at least a week, if not 2 weeks longer than we have, because they took a harder hit early on. So now that we have the testing, I mean, we have drive-through sites that are testing 250 people a day.
Mm.
And that's just in Houston, in one location in Houston.
Mm.
So if they're testing 250 people a day, probably somewhere, the last I looked, was about 5% of those people test positive. But that's a lot of people every day.
Yeah.
If you think across the state, every
Yeah.
place is testing that many people. So it looks like, oh my goodness, it's just running rampant. But we've done a lot of tests to get to those numbers. So we also have a lot of people that are negative.
Mm. Okay. Um, uh, What is it like in the hospitals right now?
Um, it's settled down a little bit over the last week or so, but it has felt very unsettling, I
Mm,
think is probably the best word. It's very unsettling. It's unsettling to have to ask patients to not come
mm,
or to delay their visit,
mm,
to have those conversations about delaying surgery. And this past week, the most difficult thing we've done, and we've done this in conjunction with other hospitals in the medical center, we've all tried to act in unison. So when we restricted visitation, we did it in conjunction with Methodist and St. Luke's and Herman. We all tried to do it at the same time
okay.
so that we would be consistent.
Mm,
But we've limited visitation to 0
mm,
in most cases. Now, we certainly have compassionate visitation for people who are at the end of life. We have, if someone is neurologically impaired,
mm,
they can have a visitor with them. If they can't, let's say they're there for a clinic visit and can't go to the restroom alone, we would allow someone to be with them,
okay.
but we're really limiting that.
Mm,
And our patients in our case at MD Anderson who are admitted for long-term treatments, like things like a transplant that might take a month of hospitalization, they are allowed to have a visitor, but there's very strict guidelines about how that visitor needs to have stayed in quarantine essentially for 2 weeks before they come, and then they can't go anywhere once they're there.
mm.
Essentially living in the hospital room with their loved one.
And all of that is part of this idea of social distancing and
Yes,
just making sure that we even practice that in the hospitals.
absolutely. And, people are in the hospital because they're ill.
Yeah.
So they're already at a higher risk of catching something. And our oncology or cancer patients, often their immune system's suppressed from their treatment. So they're at even higher risk of catching something that could be contagious.
Sure. And so I know some parents are thinking about this question. If my kid comes down with coronavirus, am I going to be able to, and needs to go to the hospital, am I going to be able to go with them?
I think in most cases the answer to that is yes, but it would be one parent, not both parents. And certainly in our case, our pediatric patients are allowed to have one parent with them. Um, but we're also pretty strict about not going back and forth and switching out,
Mm-hmm.
so that we know the person there is someone we've already screened. They don't have a temperature, they're not exhibiting any signs of having an infection. And so we ask them to stay and just stay in place.
Okay.
But we certainly have not admitted children and not allowed them to have a parent or guardian with them.
Sure. And that makes me, something people are probably thinking for their families and themselves. If I am concerned about my own getting of coronavirus, what do I do? Is that, are we now doing televisits with doctors? Is that how that looks?
Yes, we're all doing much more telehealth.
Okay.
So people who didn't already have that set up are certainly looking at how they set that up,
Just
so
like,
that we do something like this, have a Zoom meeting or a Skype call or whatever it might be, something that's protected so that your privacy would be protected. But
okay.
there would there are telehealth platforms out there that hospitals use, and I know for a fact that Methodist has a virtual urgent care,
Oh,
and
wow.
you can contact them and have a virtual visit with a physician or a nurse practitioner or PA and review your symptoms. They'll even have you hold your phone up to your throat and open your mouth
Oh,
so that they
wow.
can look zoom the camera in to look in your throat if you're complaining of a sore throat. So
Wow.
they have specific things that they do that for, though that has probably been expanded now.
Yeah.
But certainly for routine types of visits, I think not having to go into the doctor's office at this point in time is the best decision.
Yeah.
People have extended prescriptions and done things like that to keep people from having to go to the doctor.
Yeah. Well, and what would you say, just, of course, none of us want to go, none of us want to get this sickness. What is kind of the most important one or two things that we can do to keep ourselves healthy right now?
Wash your hands, wash your hands, and wash your hands.
Yeah.
That and following the social distancing from others, and really I like physical distancing better than social distancing, because I think you can socialize with your neighbors by putting a lawn chair on the end of the driveway and talking to your neighbors across the street who are doing the same thing, and be socially active without being physically close.
Yeah.
So I think that's the key.
And we need to be socially active.
Yes, we do.
Distant. Yeah. What about like food items or other things that are delivered from the outside to our homes? Like, is there risk there?
There might be a slight risk. I think wiping off the outside of a container is probably the smartest thing you could do. Just take some, Clorox wipes or some sort of wipe and wipe down the plastic bag or the pizza box or whatever the container is. And that's probably fine. We need to remember this is a droplet. It's contagious through a droplet, so it's not really airborne. And we aren't sure at this point how long it can live on surfaces, but it's very highly unlikely that you're going to become contaminated or get the disease from a delivery unless your deliverer is highly contagious while they're handling your food.
Okay, that's comforting.
Yeah.
Let me ask, kind of back to the bigger scope. Do you anticipate that we'll have like a really high increase in cases here in Houston, like we're seeing in some other cities?
I hope not. I think it's important to remember we're going to see more cases now because of how many are being tested. So that's number one. But I'm hopeful that we implemented the whole social distancing, the stay-at-home orders, and we don't live on top of each other in the same way as they do in parts of Europe or even in New York or San Francisco or Chicago. We don't have the same type of mass transit. There are things to be said for the fact that we all get in our individual vehicles and drive and pack up the freeways right now, because that is just keeping us more isolated or apart from other people who might be ill. I think we'll continue to see it go up, but I'm hopeful that it doesn't go up at the same rate that we're seeing in New York in particular right now.
So in the hospitals, I know that they're really preparing for the possibility of a lot of cases. And obviously you can't predict the future, but the hope is that maybe we won't need all of the capacity that we're planning for. Is that right?
That is the hope, but I think what we've all done as we've limited surgeries and not done elective cases, as we've looked at why we're admitting people to the hospital and trying to manage people on an outpatient basis more than on an inpatient basis, I think most hospitals have probably selected areas of their hospital where they have units prepared to be able to take care of patients with COVID-19 and have them all grouped together.
Okay.
So that they're not spread out through other units, but once it's suspected, move them somewhere where they receive specialized care. And once it's confirmed, maybe move them elsewhere, but trying to cohort, if you will, put cohorts of patients together.
Yeah. There's a lot of medical workers in Houston. There's a lot of medical folks in our church.
Mm-hmm.
And what's life like for you guys right now? I'm sure it's not the same for everyone, but what's it like? How's it different?
It's unsettling for sure. I think there's been a lot of fear. There's a lot in the news about not having enough personal protective equipment, or PPE, masks, gowns, gloves, primarily. And so, and some sort of eye protection, goggles, or a face shield. We have not actually had that at our hospital. We've been conserving the use of our personal protective equipment for several weeks and ensuring that it's used appropriately so that we didn't run out. But it's definitely high on everyone's mind on whether or not they might run out of that. And that being blasted all over the news just adds to that sense of whether or not I'm in danger or something could happen to me. Without a doubt, nurses and doctors are taking a deep breath and going forward and caring for people regardless. And I have to say, I said nurses and doctors, that's speech pathologists, that's respiratory therapists, that's nursing assistants, medical assistants, people in nutrition, people who deliver the trays, people who clean the rooms. There's lots and lots of people involved. And in our case, we asked for volunteers. So we have volunteers who stepped up and offered to be on the team that would take care of any patients who are confirmed to have COVID-19, both inpatient and outpatient. So that may end up being any and all of us as time goes on.
Yeah.
But certainly we had a large group of people who volunteered.
Wow. We really appreciate our medical people, but gosh, it just makes you so much more aware of how much y'all do and are willing to do now. And that's just a big thanks. Are y'all working a lot more hours? Are you obviously there's a little bit of a higher level of stress because we're all in new territory here. A much higher level of stress. Yeah. Yeah.
So yes, I think most people have been working more hours. I think towards the end of this past week, we took a deep breath and said, wow, we're working a lot of hours and we need to come up with a plan. And so many people are looking at how they can rotate and get some downtime and work remotely if possible. We've sent, MD Anderson has a workforce of like 22,000 people.
Wow.
And we've sent thousands and thousands of those people home to work remotely. There are other people who've been repurposed, if you will, because the staff cafeteria is closed. So now the people who worked there are helping with other things because their work really can't be done from home. So we're trying to keep people on the payroll but doing things that are needed right now. And I think all the hospitals are probably doing that. But that's just another layer of stress for people who are worried about losing their jobs because our sense of normal is not normal right now.
Right. Yeah. Well, Ginny, how can we as a church kind of support and serve and pray for our medical friends and family and church members right now?
Well, I think prayers is great. I think anyone who's able and healthy, donate blood or blood products. That's a huge thing right now. Certainly just being supportive, checking in on your friends that you know are somehow involved in the medical community or in the
Yeah.
healthcare world, and just saying, hey, I'm thinking about you. But I
Yeah.
think the biggest thing we can all do is follow the rules, follow the regulations that are being put in place, even though they're very inconvenient,
Mm,
and try to help slow the spread. That's
mm.
really one of the biggest things we can all do. And that supports everybody. Check in on your elderly neighbors.
Yeah.
Don't go, I will tell you, Neil and I went and saw our parents at the first weekend in March, and we told them then that we probably wouldn't be back to see them in a while
Wow.
because they're all over 80.
Yeah.
In fact, my dad's in his 90s, and we didn't want to expose them to anything.
Yeah.
So, as hard as that is, we all need to think about things like that as well.
Yeah. Yeah. Well, Jenny, thank you so much. Really appreciate you giving us your time. And it was really helpful for me. Yeah, I just want to say thank you, and that we're praying for you guys as a church, and so appreciative of you. Thank you.
Thanks, David. We feel those prayers and we appreciate it very, very much.
Okay. All right. Well, we'll catch you. We'll catch you later. Okay.
All right, online.
Yeah.
Bye.
Bye.